Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Well, there is an option for patients with heart problems. Doctors are recommending a defibrillator that's actually implanted under your skin. It can provide an automatic electric pulse in the event something interrupts your heart's rhythm. And here to talk about this space-age sounding technology is Dr. Charles Joyner. He's from Virginia Cardiovascular Specialist. Dr. Joyner, thank you for being here.
Absolutely.
Well, just tell us briefly, how does this work?
Well, the traditional defibrillator involves placing a pulse generator, as we call it, with a battery under the skin and a lead or multiple leads that go into the vasculature, the blood vessels, and they go down to the heart. So that leaves you with a very good functioning device, an adequately functioning device, but you've got something inside your vascular system and inside your heart all the time, and that raises the risk of certain other things over time. Well, what they did is devised a defibrillator that doesn't involve going inside the chest at all. It's entirely placed under the skin. So it's outside the rib cage, but entirely under the skin. So you don't run the risk of anything in terms of damage to your blood vessels. If it needs to be removed, you don't run risk to the heart, that kind of thing. The risk of infection is probably lower over time.
Okay, so if it senses there is a problem, how quickly can it work?
It works very fast. I mean, these things always work better than and faster than people if people were around to make the decision.
Right.
It can make the decision in seconds. It can charge up in about, usually about 15 seconds in this case. These devices are a little slower than the typical defibrillators, but certainly very good at delivering a shock to save your life.
And who's the best candidate for something like this?
We think the right candidates for a subcutaneous or SICD are younger people who are going to need a device for a longer period of time and may not want a lead inside their heart or inside their blood vessels, people prone to infection, people who you don't want to have lead problems with over time, people who already have things implanted in their vasculature, catheters or valves in the heart, that kind of thing.
And who's the best person to talk about it if you think you might be a candidate for this?
Well, defibrillators, you need to talk to a cardiac electrophysiologist. Now, general cardiologists refer patients to us, so you can talk to any cardiologist about that, but they will subsequently refer you to an electrophysiologist who would be the one to make the decision, talk with you, and put it in.
All right. Dr. Joyner, thank you for this information.
Absolutely.
Really
thank you.
All right. Thank you. And if you'd like more information about this procedure or the doctor treating it, just refer to our website, NBC12.com. All right. Let's get a check now on